Hi, this presentation is regarding Kentucky Senate Bill number 89 and supporting autonomy for advanced practice registered nurses in Kentucky. This presentation was created by Karen Keller, David Kuntz, Tatiana Jack Ruddick, and Petronella Trina Mathieu for PC 729 Health Policy and Advocacy. As a disclaimer, the views or opinions expressed in this presentation are solely those of the authors and do not necessarily reflect the views or opinions of Frontier Nursing University. So what's the big deal? So current policy in the state of Kentucky limits access to care by limiting the scope of practice of advanced practice registered nurses. This is an unnecessary set of laws and policies, and there's no evidence that shows the efficacy of continuing this practice. And there are some groups in the state of Kentucky who even have begun to, in a very inappropriate contextual way, of blaming nurse practitioners for the current opioid crisis in the state. So patient care outcomes for advanced practice registered nurses are actually equal to or even better than the outcomes of physicians. And this is well documented across the nation. Kentucky is also considered to be in a healthcare shortage, as you can see from this infographic. Many of our communities are medically underserved, and nurse practitioners have and will continue to fill in the void for providers in this state. So it's very important that we are allowed to practice to the full scope of our education. There's over 1 million Kentuckians that reside in what are called healthcare professional shortage areas, which are below federal standards, and there's a disproportionate ratio of providers to the population that needs to be served. APRNs have already proven our worth and value in all areas of healthcare, but especially in these HCPSA areas. In Kentucky, there's over 7,500 APRs that practice independently, with the exception of a collaborative agreement for prescriptive authority, which Senate Bill 89 would seek to remove that requirement and allow APRNs to practice to the full scope of their practice. And another thing that's very important to recognize that in Kentucky, advanced practice registered nurses have actually had a twofold decrease in the number of opioid prescriptions that have been written in the state by APRNs, which as opposed to our physician colleagues whose opioid prescription numbers have actually increased. APRNs are restricted due to this collaborative agreement with physicians. It often is supposed to provide oversight and prevent inappropriate prescribing by nurse practitioners. A lot of times, though, that's simply the APRN has to pay a physician to sign a contract that says that they will provide oversight. It's also, APRNs are unable to apply for a drug enforcement agency identifier without a physician's signature. And this is important not just because, or just to write for opioid medications, but it also has a lot to do with whether or not you can order supplies or injectables or certain types of antibiotics. And this is puts a lot of burden on advanced practice registered nurses who own their own clinics, and those are typically in those low provider areas too. So this creates even more burden for advanced practice nurses and ultimately for the patients. APRNs are actually dedicated to finding a solution for the healthcare provider disparity and the opioid crisis in Kentucky. But in order to do that, we need to have full autonomous practice. And again, in 2 years, APRNs have reduced the number of opioid prescriptions that we've written by twice the number of all Kentucky prescribers, including our physician colleagues. Kentucky APRNs support Senate Bill 89 and the regulatory oversight of all prescribers by using the Kentucky All-Schedule Prescription Electronic Reporting System, which is required for all prescribers, not just APRNs, but also physicians as well. Senator Paul Hornback from Shelbyville and other legislators support Senate Bill 89, and if this bill passes, Kentucky would join 23 other states in the United States and the District of Columbia who have already seen the benefit of allowing full autonomous practice for APRNs. And the bill would remove that requirement of the collaborative agreement for prescribing authority, which is the only limitation we still have in Kentucky. So this presentation was prepared for the Kentucky Senate Committee on Licensing, Occupation, and Administrative Regulations. And we hope that we would like to call on this committee who will handle this bill to become involved, reach out to the Kentucky Nurses Association, the Kentucky Coalition of Nurse Practitioners and Nurse Midwives to hear exactly what we do, to understand our scope better and how we are an asset to Kentucky, not only for access to care, but also in helping to reduce and eventually eliminate the opioid crisis. We're going to ask our friends and our neighbors to write letters to the local legislators, and we're going to ask everyone to vote yes on Senate Bill 89 in the upcoming general election on November 6th in 2008.